Niacinamide is a form of vitamin B3. It can treat pellagra, boost skin health, help with diabetes, and more. Topical formulations are used for acne, eczema, psoriasis, and other skin conditions. A variation of vitamin B3, also known as niacin, consists of two forms, niacinamide or nicotinamide, and nicotinic acid. Although both molecules compose vitamin B3, they affect the body in different ways. Niacinamide is needed to make NAD+ and NADH. NAD+ and NADH slow the aging, and they support cell repair, immune function, and energy use in the body. Niacin can help skin inflammation, acne, rosacea, and psoriasis. It can reduce dark spots and skin aging. It may prevent skin cancer. It can help with diabetes, lower high phosphate levels, and it can improve arthritis. Niacinamide is water-soluble, and it can be found in animal products like meat and poultry and non-processed cereals. It's also available as a supplement. The body can also make niacinamide from the essential amino acid tryptophan, but it takes 60 mg of tryptophan to produce only 1 mg of niacinamide. Symptoms of a mild niacin deficiency include indigestion, fatigue, canker sores, and nausea. A severe niacin deficiency causes pellagra, and this manifests with dermatitis, diarrhea, and dementia, known as the 3Ds. Niacinamide at 300 to 500 mg per day can resolve the symptoms within 1 week. It's FDA approved for the prevention and the treatment of pellagra, and is preferred over nicotinic acid because it doesn't dilate the blood vessels and cause face flushing. One of the causes of acne is excess sebum production, and this makes oily skin. Topical niacinamide lowered the skin oil production in 50 Japanese people, and it decreased skin sebum level in 50 Caucasian people. On the other hand, some people with acne struggle with dry, damaged skin. Topical niacinamide increased the beneficial skin lipids called the ceramides. In turn, it strengthens the skin barrier, and it moisturizes the skin and reduces water loss. In a clinical trial on 28 people with dry skin, niacinamide cream decreased water loss, and it increased hydration in the outer skin layer, the stratum corneum, better than white petroleum. In another clinical trial on over 210 people with mild to moderate acne, niacinamide gel improved the acne, and it decreased acne lesions as effectively as the antibiotic clindamycin. Oral niacinamide combined with zinc, copper, azelaic acid, pyridoxine, and folic acid reduced acne severity, and it improved overall skin appearance in a clinical study on 235 people. The same product improved both acne and rosacea in another clinical study on 198 people. A topical gel containing niacinamide reduced skin peeling, redness, lesions, and irritation while increasing hydration and the skin barrier health in a clinical study on over 75 people with rosacea. Topical niacinamide, together with a synthetic form of vitamin D, improved psoriasis in 50% of cases in a clinical study on 66 people, compared to a 19% response with a placebo. In 48 patients with facial seborrheic dermatitis, niacinamide 4% cream, once daily for 3 months, reduced the symptoms such as the redness and the scaling by 75%, compared to a 35% reduction with a placebo cream. Niacinamide 2% cream twice daily for 2 months reduced skin water loss, and it improved skin hydration in 28 patients with atopic dermatitis. Based on cellular studies, it might soothe irritated and inflamed skin by lowering inflammatory compounds. Additionally, the niacinamide can block the growth of certain fungi that cause skin yeast infections like Candida albicans and others. 2 studies support the use of topical niacinamide for skin lightening in over 160 people with dark patches on the face. It reduced skin pigmentation, inflammation, and premature aging. A serum containing 5% niacinamide and tranexamic acid which is a synthetic derivative of the amino acid lysine, improved skin tone, evenness and texture in a clinical study with over 97 women with hyperpigmentation or dark skin spots. Combined with vitamin C and ultrasound radiation, topical niacinamide decreased skin colouring after 4 weeks in 60 people with hyperpigmentation. In cell studies, niacinamide blocked the transfer of melanin deposits to the outer skin layer, and this can explain its skin lightening effect. Topical niacinamide improves the skin appearance and it reduces dark skin patches, both alone and in combination with vitamin C. Niacinamide stimulates the production of collagen and protective proteins, which give structure and elasticity to the skin. It can help to smooth out wrinkles and to prevent premature skin aging from UV rays or photoaging. It may delay skin aging by restoring DNA damage and by lowering oxidative stress. Topical niacinamide decreased wrinkles and fine lines, skin redness and yellowing while improving skin elasticity in a clinical study with 130 women. In 4 trials of over 300 women, topical cream with niacinamide and other herbs and vitamins like retinol, resveratrol, safflower, vitamin E, kynotin and others reduced the appearance of wrinkles and fine lines, and it improved skin complexion. Topical niacinamide helped to reduce wrinkles and fine lines, giving the skin a more youthful look. Non-melanoma skin cancer is usually caused by excessive UV radiation, and this can damage the DNA in the skin cells and reduce their immune function. The most aggressive forms include squamous cell carcinoma and actinic keratosis. In a clinical study of 386 people with a high risk of skin cancer, oral niacinamide reduced the rate of non-melanoma skin cancer by 23% compared to a placebo. More precisely, it lowered the rate of new squamous cell carcinomas by 30% and actinic keratosis by 13%. In another clinical study of 74 people with skin cancer, oral niacinamide decreased actinic keratosis when compared to a placebo. In human cells and mice, topical and oral niacinamide enhanced DNA repair, and it prevented UV-triggered immune suppression. It also reduced the growth, the spread, and the survival of melanoma cancer cells. According to preliminary research, oral niacinamide may help to prevent skin damage and cancer caused by excessive UV exposure. People with chronic kidney disease often have dangerously high blood phosphate levels. In clinical studies with more than 450 adults and 60 children with kidney disease, the oral niacinamide decreased high blood phosphate and increased the good HDL cholesterol without changing the calcium levels. In rats, niacinamide reduced the activity of a transporter that carries sodium and phosphate from the gut into the bloodstream, thus lowering the phosphorus blood levels. Oral niacinamide may be beneficial for people with kidney disease as it lowers the blood phosphate levels. In people with type 1 diabetes, insulin-producing beta cells in the pancreas get destroyed. Low insulin, high blood sugar, and low C-peptide often point to type 1 diabetes. In clinical studies with over 343 adults and 300 children with type 1 diabetes, adding niacinamide to insulin therapy maintained the normal C-peptide levels. It preserved the function of the beta cells and it helped to delay disease progression. Niacinamide improved C-peptide and blood sugar levels in a small trial of 18 people with type 2 diabetes. In rats, niacinamide prevented diabetes by reducing beta cell destruction, by lowering oxidative stress, by improving immune function and maintaining normal insulin and glucose levels. Oral niacinamide may help to delay the progression of type 1 diabetes, but it likely can't prevent it. It may improve blood sugar control in type 2 diabetics. Niacinamide blocks the inflammatory compound interleukin-1. This contributes to osteoarthritis. In a clinical study on 72 people with osteoarthritis, the niacinamide improved the joint movement, it lowered inflammation, and it decreased the use of anti-inflammatory drugs when compared to a placebo. In 30 people with schizophrenia, vitamin B3, both niacin and niacinamide, improved the symptoms in 80% of the patients after 1 year, compared to 33% in the placebo group. In rats, niacinamide reduced brain damage and it improved recovery after a stroke in mice. It decreased the expression of a gene that's linked to Alzheimer's disease, while restoring cognition and improving memory. It may lower oxidative stress in the brain and reverse damage to blood vessels and nerve cells. The oral niacinamide may protect the brain and prevent neurological disorders. Topical niacinamide is considered to be safe and non-toxic up to a concentration of 4 to 5%. Common mild side effects include skin redness, itching, dryness, and flaking. Oral niacinamide is safe at doses that don't exceed the safe upper limit. In adults, this limit is 35 mg daily. Most short-term studies use doses above the upper limit, and they report no safety issues. Possible mild effects could include nausea, cramps, and diarrhea. In rare cases, it can cause a low platelet count, or thrombocytopenia, and this can lead to excessive bleeding and prevent wounds from healing properly. In extremely high doses of over 3 grams, niacinamide can be toxic to the liver and cause insulin resistance. Very high doses, 2 grams per kg, in rats caused an increase in the risk of diabetes type 2, and high doses also cause liver damage, tumours, and stunted growth in animals. A topical gel or cream containing 4 to 5% of niacinamide applied to the skin twice a day for 8 weeks reduces acne, hyperpigmentation, and skin aging. For acne, 750 mg of niacinamide, 25 mg of zinc, and 1.5 mg of copper, and 500 micrograms of folic acid, once or twice a day, were shown to be beneficial. For pellagra, 300 to 500 mg of niacinamide per day. For skin cancer prevention, 500 mg of niacinamide once or twice a day. For diabetes, 25 to 50 mg per kg of niacinamide taken daily for delaying the progression of type 1 diabetes. For reducing high phosphate levels, 500 mg up to 1.75 grams per day of niacinamide for 8 to 24 weeks. For osteoarthritis, 3 grams of niacinamide daily for up to 12 weeks. Niacinamide is a form of vitamin B3 and it supports cell repair, immune function, and energy use in the body. Taken orally, it can support skin health, slow the progression of diabetes, and reduce high phosphate levels. Skin conditions that can benefit from topical niacinamide include acne, eczema, psoriasis, rosacea, and seborrheic dermatitis. Creams and gels with up to 5% niacinamide can also reduce dark skin spots and signs of aging. Unlike regular vitamin B3, niacinamide does not cause flushing. Both oral and topical forms are safe and well tolerated. You can avoid extreme doses of over 2 grams, as this may be dangerous though. However, Abram and Hoffer from Saskatchewan Psychiatric Facility would use large doses of niacinamide with vitamin C successfully in schizophrenic patients. Linus Pauling, the Nobel Prize winner, also commented on their use of the high-dose niacinamide. For more information about herbs, supplements, and natural treatment methods, check out my website.